Good morning. My name is Eric Gall. This is my presentation on cardiomyopathy for Jill McMillan's class of Structure and Function of the Human Body. Cardiomyopathy is a condition of the heart. You can see that from the phrase cardio in the word there. Every year in the United States alone, 610 deaths are caused by heart disease, and each one of those heart disease cases has some form of cardiomyopathy associated with it. Cardiomyopathy is defined as a decrease in the ability of the heart to effectively pump blood to the body, or a decrease in the ability to fill the heart's chambers, particularly the ventricles. This slide here and this picture show an overview of how the heart works and how the flow of blood comes in and out to kind of give a better frame of reference for how cardiomyopathy can cause problems with the body. On the right side of the heart, this is flipped around because it's an anatomical drawing. On the right side of the heart, deoxygenated blood comes into the right atrium and into the right ventricle, which is then pumped to the lungs to receive fresh oxygen from the air that we breathe. The left atrium is filled up, and then the left ventricle is filled up, and that contracts and pumps the fresh blood out to the body to nourish our cells. As I stated before, the cardiomyopathy diagnoses center around the left ventricle here. The oxygen that we breathe and comes into our blood and is circulated around the body is needed for the production of ATP, which is our body's energy source. If the heart cannot properly fill up, or if it can't properly pump the blood out to the body, then the cells will not receive the oxygen that they need to perform almost any of their functions. There are three major types of cardiomyopathy, which we'll go into in more detail in a few minutes. The first is dilated cardiomyopathy. This is where the heart is too large. There's hypertrophic cardiomyopathy, where the heart is too small, and restrictive cardiomyopathy. The heart muscles cannot stretch. Here we see a diagram of a heart affected by dilated cardiomyopathy. It's characterized again by an enlarged heart. That's where the word dilated comes from. It's easy to remember. Because the muscles of the heart are so much bigger than they need to be, the cells within the muscle tissue of the heart or the cardiac tissue are too far apart to be effective and strong enough. This causes a problem with the heart being able to not get enough blood out of the heart and move it quickly enough. The larger chamber isn't able to fill up as effectively, causing problems with pressure, as well as, like I said, the conduction problems within the cardiac tissue itself because of the kind of stretched out nature. Dilated cardiomyopathy has been shown to be caused by a preceding heart attack. It also can be caused by toxic substances such as alcohol or anti-cancer treatments. The second form of cardiomyopathy is hypertrophic cardiomyopathy. This is a genetic form of the disease. You can see on the heart shown on the right here that the left ventricle is far, far too small, and the cardiac tissue around it, the muscle tissue, is very enlarged, causing it kind of shrinks in and makes that space there, that ventricle, quite a bit smaller. Because of the small volume that the left ventricle is able to fill up with, the heart has to beat extra fast and extra hard to move the appropriate amount of blood through the heart and into the body. Because of this, the muscle, just like any other muscle in our body when it's worked regularly, becomes stronger and stronger and stronger. This makes the muscles grow larger, and the problem creates a positive feedback loop. Because of the condition, the heart has to work harder, and because it has to work harder, the heart becomes more affected. This is the most common heart-related cause of sudden death in children, and also causes about 1/3 of all sudden death in athletes, as I'm sure you can imagine. The last form of cardiomyopathy is restrictive cardiomyopathy. This one has very similar symptoms and problems as the other two versions. The heart is still not able to contract properly. But this one is because the heart muscle itself is stiffened, either due to scar tissue or another disease. Signs and symptoms of cardiomyopathy, they are often masked by other conditions, and it's a condition that can go undetected for quite a long time if you don't know what to look for. The best way to diagnose the disease is through an echocardiogram or by analyzing the patient's stroke volume compared to their expected values based on their age and their body surface area. A new form of imaging is cardiac magnetic resonance imaging, which is a mouthful, but that one is gaining popularity because it is able to get much better measurements on the volume and the volume of those ventricles. You may have patients that experience shortness of breath. This is because the blood is not able to move out of the lungs as quickly as it needs to. So there will be fluid buildup in the lungs, and that would cause shortness of breath. There may also be associated arrhythmias or irregular heartbeats. This is caused by that stretched out, kind of misaligned cellular structure of the cardiac tissue, which affects its ability to conduct the nerve impulses. And because of the low energy and the oxygen not being able to get to the rest of the body, the patient may also have activity intolerance. If the disease is allowed to progress without intervention, the heart will eventually fail every time, leading to sudden cardiac death. There are a few treatment options, but the main thing to remember with treatment for cardiomyopathy is that we are trying to alleviate the symptoms. We're not trying to cure the disease. The heart itself is damaged or misformed, so the best that we can do is try to slow the progression and to alleviate the negative symptoms. There are a couple non-pharmacological interventions, including a healthy weight and improving your diet with better nutrition and less fats. And there's also increasing exercise. As tolerated because of that activity intolerance, they may need to start slow and light. But a big cause for heart disease in general and cardiomyopathy along with that is obesity and poor nutrition. Once those non-pharmacological interventions have been implemented, there are also some drug therapies that can be included, ACE inhibitors and beta blockers to treat the arrhythmias that may happen, and the loop diuretics to kind of get rid of some of that excess fluid to help with the shortness of breath. As the disease progresses, which it will, there may be some surgical options that need to be implemented. A pacemaker can be put in to resynchronize the right and left sides of the heart. A cardioverted defibrillator to restart the heart quickly if it fails. Heart failure is the end result of cardiomyopathy. So having that in place is kind of a safeguard, can extend the life of the patient. And ultimately, if things get bad enough and the disease progresses far enough, a heart transplant may be the final option. The short and long-term effects of cardiomyopathy are directly related to their symptoms. The symptoms are often hard to detect, and again, they may be masked by other conditions that the patient has. That means it's left to us to detect cardiomyopathy so that it can be intervened upon. The short-term effects activity intolerance is going to be the main one, that shortness of breath, that low energy because the oxygen is not getting out to the cells. And there may be some other short-term effects associated with that activity intolerance because the patient may get lazier about their activities of daily living just because moving around becomes difficult and laborsome. So there may be some other health concerns that come up from the patient not taking as good care of themselves as they could if they were able to move around. The long-term effects we went through again. The positive feedback loop is the main thing to remember. The heart having to compensate for its deformity causes the condition to get worse and worse. Cardiomyopathy ultimately leads to heart failure. So getting a diagnosis and treatment options in place early is the best option. Therefore, if patients have a family history of heart disease or cardiomyopathy, they should be strongly urged to get screened for early signs. In conclusion, cardiomyopathy is a condition of the heart that is associated with all forms of heart disease. The main part of the heart that we're talking about is the left ventricle's ability to effectively fill and pump oxygenated blood from the lungs to the body. Patients with cardiomyopathy are often asymptomatic until it is too late. The health history and screening are vital for early detection. There are treatment options available, but they mostly focus on prevention of complication and treatment of signs and symptoms, such as shortness of breath and arrhythmias. I want to thank you for your attention today. I can be reached via my email if there are any questions or anything else that I can provide. I hope in your future career that you will keep cardiomyopathy in mind so that you can help your patients live happily and healthily. Thank you.